Hi everyone, this is Danielle Thorn. The first of the three microbes that I'm going to be talking about is Staphylococcus. Staphylococcus is a gram-positive bacteria. There are more than 30 types of staphylococcal bacteria, but the most commonly known is Staphylococcus aureus because it is the causative agent for most staph infections. It is a facultative anaerobic organism, meaning that it can grow both with and without the presence of oxygen. Staphylococci can form many types of infections. S. aureus causes skin lesions and abscesses. It can cause endocarditis and osteomyelitis. It can be responsible for the infection regarding implanted devices when it is in conjunction with Staphylococcus epidermidis. Food poisoning is also the response of Staphylococcus releasing enterotoxins into food. Toxic shock syndrome is Staphylococcus releasing superantigens in the bloodstream. There are several other types of Staphylococci that are not known to be pathogenic, and there are some that are. They are salt tolerant and often hemolytic. Staphylococcus aureus and Staphylococcus intermedius are both coagulase positive, and this helps with identifying and isolating species. Staphylococcus can express many potential virulence factors, including the colonization of host tissues through surface proteins. They inhibit phagocytosis with a capsule or certain immunoglobulin proteins. Toxins also damage the host tissues, reducing our immune system and our ability to fight back. Coagulase negative staphylococci are normally less virulent. Staph infections from Staphylococcus aureus can also spread through the improper handling of food. People who are at higher risk of staphylococcal aureus staph infections are those with a lower immune system or anyone who is using a catheter, breathing tube, on dialysis, or injecting drugs, because this creates an opening from the outside of the body to the inside, where the surface bacteria on our skin and on our noses have a path into the body. This here is just a depiction of a an infection just underneath of the skin. Symptoms of staph infections can look like pimples or boils. They might turn into impetigo with a crust on the skin, or cellulitis, swollen and red and hot. Osteomyelitis might have pain, warmth, swelling, redness in the area. It can also be accompanied with fever and chills. An infection in the heart tissue will often have flu symptoms such as fever, chills, and fatigue. They can also have a rapid heartbeat, shortness of breath, and edema in the limbs. Food poisoning typically has a gastroenterological response, including vomiting and diarrhea, which can lead to dehydration. Pneumonia symptoms are typically high fever, chills, and a cough that doesn't improve. And toxic shock syndrome can be very serious. It can lead to organ failure. It starts with high fever, low blood pressure, vomiting, diarrhea, and confusion, and sometimes there is a rash. The Staphylococcus, when it is in our stomach, it can cause acute episodes of food poisoning via preformed enterotoxins. In the skin and hair, there can be infections when the cutaneous barrier has been disrupted, like we mentioned before. Systemic infections can arise and lead to endocarditis in IV drug abusers, osteomyelitis in the bones, sinus infections. It is a very common nosocomial infection, and especially methicillin-resistant Staphylococcus aureus, MRSA. And the risk factors for MRSA colonization or infection include prolonged exposure to anybody who may have been infected, being present in the intensive care unit, prior antibiotic exposure, or having any kind of a surgical incision. Treatment for staph infections is typically antibiotics. Depending on the type of infection, you may get a topical cream or ointment, you may have pills to swallow, or you may get antibiotics IV. If you have an infected wound, the provider might choose to drain it, or you may need to have surgery. There are, again, MRSA are antibiotic resistant species, so they require a stronger treatment. Staphylococcus aureus are susceptible to beta-lactamase resistant penicillins, and vancomycin is typically the drug of choice for MRSA infections. I do want to mention that the capsule and the protein A interfere with phagocytosis, which is our body's natural way of combating staphylococcal infections, and biofilm on implants is impervious to phagocytosis. The next thing that I want to talk to you guys about is H. influenza. This is also a facultative anaerobic bacteria. This is a gram-negative coccobacillary bacteria. What that means is it is not quite spherical cocci, and it is not quite bacterial rods. It's somewhere in between there. They can be encapsulated, and those are typable. There's types A through F, and there's also a non-typable, unencapsulated version. They are pathogenic, so they do cause disease. H. influenza typically refers to any disease caused by the H. influenza bacteria. Some of these include ear infections and bronchitis, which are typically just annoying, but there can be serious conditions as well. H. influenza can affect anybody of all ages, and usually are more found in ear infections and that sort of thing of young children. One type of H. influenza does actually have a vaccine. That's type B. That's the Hib vaccine, and the CDC does recommend that anyone under 2 years of age get this vaccine, but it does only work against that one type of H. influenza. So these bacteria typically live in our noses and in our throats and don't always cause harm, but they can move to other parts of the body and create an infection. The H. influenza have evolved a number of strategies to evade the host defense system, including the ability to invade local tissue. The pathogenic properties of this bacteria, as well as defects in our own host system, can result in the spread of the bacteria from the upper airway to the bronchi of the lung. This can result in airway inflammation and can lead to COPD. A key factor in the pathogenesis of the non-typable H. influenza is its ability to adhere to the respiratory mucosa. This appears to have a preference for non-ciliated cells or damaged mucosa. There are specific mechanisms which the non-typable strains use to adhere to the mucosa. The CDC reports that H. influenza transmits through respiratory droplets. People who already have a weakened immune system, people who are younger than 5 or older than 65, or of American Indian or Alaskan Native descent tend to have more susceptibility, as well as anybody who is already fighting another condition. Those bacteria spread whenever we have close contact with somebody who's been infected. People who are not sick can still have the bacteria in their noses and throats and spread the bacteria. So H. influenza can invade the spinal fluid, causing meningitis, or in the bloodstream, causing bacteremia. Invasive disease is usually severe, requiring treatment in a hospital, and can sometimes result in death. The most common types of invasive disease caused by H. influenza include pneumonia, bacteremia, meningitis, epiglottitis, cellulitis, and infectious arthritis. And as I mentioned before, it's a common cause for ear infections in children and bronchitis in adults. The H. influenza disease in the United States has reduced significantly since the implication of the HIV vaccine. That's only good for the type B influenza, but non-typeable H. influenza causes the majority of invasive disease among all of the groups in the United States at this point in time. Rates among adults remain stable and higher than in those specific areas that we mentioned before. Ampicillin resistance due to non-typeable H. influenza's production of beta-lactamase is recognized and is a significant concern. As such, H. influenza is one of the 12 pathogens that are considered a priority by the World Health Organization because non-typeable H. influenza contributes to about 21,000 otitis media infections and deaths per year. And there is no vaccine for this type of H. influenza. The antibiotic resistance of this type of bacteria have made it particularly tricky to treat. This just gives you sort of an example of different places where the H. influenza can create infection. Signs and symptoms of infection of H. influenza, including type B, pneumonia is lung infection, fevers, chills, cough, shortness of breath, difficulty breathing, sweating, chest pain, headache, muscle aches, excessive tiredness. Bacteremia is an infection in your bloodstream. It can cause fevers and chills, excessive tiredness, pain and nausea, altered mental status, which can include confusion. Meningitis is an infection in the tissue covering the brain and spinal cord. Symptoms typically include a sudden onset of fever, headache, stiff neck, nausea, photophobia, and altered mental state as well. Typically, doctors would diagnose this by running labs, including a spinal tap to test the fluid in your spine. Doctors treat H. influenza, including the HIV disease, with antibiotics, and while H. influenza causes milder infections like bronchitis or ear infections, you might still be given antibiotic to prevent complications. Other treatments for H. influenza infections include breathing support when necessary, medication to treat low blood pressure, or wound care for parts of damaged skin. The complications are rare and typically not severe for bronchitis and ear infections, but even with appropriate treatment, some H. influenza infections can result in long-term problems, including blood infections, meningitis, and a small number of children actually do die from the meningitis caused by the H. influenza bacteria. Vaccine, again, is available, but only for type B. And this is some imagery of the H. influenza and different techniques. Mycobacterium tuberculosis is the third microbe that I'll be talking about today. Mycobacterium tuberculosis is a pathogenic bacteria. It is the causative agent for tuberculosis. Pulmonary TB has been described as consumption, and it is one of the oldest known diseases. It is a disease that primarily affects the lungs, although it can affect other parts of the body. It spreads through expelled airborne droplets, much like the flu or cold. When inhaled, the bacteria can settle in the lungs where it begins to grow, and if not treated, is able to spread to other areas such as the kidneys, the spine, and the brain. According to the CDC, there were more than 9,000 new cases of TB reported in 2017. TB is the oldest known human disease. It goes back over 4,000 years, and 2 million people die from this disease each year. There are many manifestations affecting the bone, the nervous system, and organ systems, but like I mentioned, it is primarily a pulmonary disease that is initiated by the deposits of Mycobacterium tuberculosis into lung alveolar surfaces. This imagery shows somebody with an active TB infection. TB crosses the mucosal membrane to infect the lungs when small airborne particles distribute to terminal alveoli, where resident alveolar macrophages or tissue cells ingest the airway bacteria. These bacteria are able to survive even with ingestion into